Dr. Kimberley Wilson here, physical therapist, pelvic floor specialist, Mercier therapist, and all things women health. Let's talk a little bit today about why you might be experiencing signs and symptoms of an overactive pelvic floor after you have a hysterectomy. A hysterectomy is a very common surgical procedure. It involves the removal of the uterus and sometimes the ovaries too. And it can really impact the pelvic floor quite substantially. And so I want to talk about maybe four reasons why that might be the case. So a hysterectomy, whether it's done laparoscopically or if through an open surgical procedure, it's going to interrupt the efficiency of the core musculature. And so there is this deep-rooted connection between the core and the pelvic floor, and that could be a whole nother video. But what I will say is that anytime that you interrupt the layers of the core, so we're talking about going through certainly skin and dermis, epidermis, fascia, layers of muscles themselves, and then we get into the organ piece of it, or the visceral piece of it. So you're interrupting a very, very efficient system typically, and now it becomes a little less efficient. So now our core is not necessarily coordinating with the pelvic floor. And so in response, the pelvic floor could then become more tense. It could be more overactive. It could be guarded and holding a lot of tension in the pelvic floor region. And then secondly, I'd like to say that anytime you have a surgical procedure, it will result in the formation of a scar tissue. So the scar tissue, whether it be through the abdominal cavity or through the vaginal area, it's going to form scar tissue, and scar tissue is not as movable, not as pliable, not as responsive as normal healthy tissues would be. So when you think about the connection between the core and the pelvic floor through your breath work, you're going to have a harder time communicating or moving that pressure gradient system as efficiently as you were prior to the surgical procedure. And so a lot of times the pelvic floor is dependent upon the responsiveness from the diaphragm. So the diaphragm sits under the ribs, and this whole diaphragm, abdominal cavity, and pelvic floor that forms sort of this nice little piston that houses pressure. And now that system's interrupted. So the pelvic floor isn't able to respond the way it normally would before the surgical procedure. And so it becomes less mobile. And any muscle that becomes less mobile in your body has the potential for building up a lot of tension. And also, if your core is not working as efficient for stability, the core being one of the primary stability providers for everybody, the pelvic floor sometimes comes in and tries to be a core helper, and so it will work really, really hard, much harder than it normally would, to try to stabilize everything, because your body's the great compensator, and it'll always try to get you where you need to be, but sometimes not using the right strategies, techniques. So those are two reasons that the pelvic floor might end up being what we call tight or overactive after a hysterectomy. And the third reason is because you just had surgery. So you might also develop some protective mechanisms, meaning you might sort of like hold in tension through the abdominal cavity, just sort of protecting an injured area, and through the pelvic floor as well. So you sort of like draw up. That's our natural protective mechanism, is to sort of like ball up when there's injury of any kind, whether that is a physical injury or an emotional injury. Our tendency is to just sort of ball up into flexion and be very guarded to protect ourselves. Think about an inchworm or something like that. When you poke a worm, how it balls up to sort of protect itself. That's kind of our natural way of reacting to a potentially dangerous situation. So it happens that after you have surgery through the abdominal region and the pelvic floor, that we tend to be a little bit guarded without realizing it a lot of the time. And so those muscles will be, in a sense, overactive because they're contracted to keep you sort of protected. So that could be a reason why you're developing too much tension in the pelvic floor. And then fourthly, I just want you to think about what happened during the surgical procedure. If this is the pelvis and all of this red stuff here, that's representing the muscles of the pelvic floor. So if I turn it upright, then this space is going to be where the uterus is held. So the uterus sits about at this level, and then the ovaries on each side. And so if you take those organs out of this space, we have an empty space where organs used to sit that provided a support system for everything above it. So think about large intestines, small intestines, on up the chain. We have, the liver and the pancreas and the stomach and everything kind of above the uterus. So now everything can sit down a little bit lower, but that's not the normal. That's not the norm, right? And so everything then starts to change. Your breathing is different. The response of the pelvic floor is different because the anatomy is different. One thing that can happen is that tension builds up here. And it could be a combination of all four of those reasons. And there are other reasons, but those are very common things that can happen. So what can we do? What can we do about it? As a pelvic floor physical therapist, those are the kinds of things that we do work on. Obviously, we want to first make you aware of what's happening at the pelvic floor level. Can we reproduce maybe some of the tension that you're feeling there? And can we help you learn how to let that go? Number one on the list is always going to be to restore the deep breathing mechanism. So that diaphragmatic breathing is so important. I wish that I could, open the veil, so to speak, and let you see that diaphragm at work. It's so muscular, and every time you're breathing in, the diaphragm is moving down, and so it's moving all the contents of the abdomen into that pelvic floor, and the pelvic floor sort of acts like a catcher's mitt, or at least that's sort of a visual that I have in my brain. It's sort of sitting there like a catcher's mitt, so that every time you're breathing in, it's accepting that gentle movement that happens as a result of the diaphragm moving down. But surgery interrupts those systems. Those are innate systems. Those are the systems that we're born with. It just doesn't take a lot of change in the body to interrupt those systems that work automatically. And so they get a little bit out of whack. And so we have to restore those systems. Sometimes you need a skilled hand to help that, to somebody that can give you some feedback, what you're doing right and wrong, and how we might work to restore that in your body. An overactive pelvic floor can be quite symptomatic. You might find that you're having pain in the pelvic region. You might find that you have chronic pains in your hips, one or the other or both, that just simply won't go away no matter how much you work to stretch or strengthen the area. Could become pelvic floor. You could have other pelvic floor symptoms like urinary incontinence or frequency or urgency, constipation or diarrhea. Those are all things that can happen when we have some pelvic floor dysfunction. Certainly, those things can happen after a hysterectomy. Probably going to be a little bit more at risk for things like prolapse. Now that support system is gone, there's more room for the bladder to shift and move. There's more room for potentially the rectum to then prolapse into the vaginal area as well. And so you are more susceptible to those things. And if you have a pelvic floor that's tense or overactive, it's not going to be very efficient at protecting those areas. We need pelvic floor to both relax and to contract as it's meant to in order to have what we consider a strong, efficient pelvic floor core system. So I hope this gives you some things to think about. Like I said, hysterectomies are still very common procedures, and I feel like there is lots of women out there that potentially could hear this video that are maybe dealing with some of those same symptoms and issues. And I would just encourage you to first think about maybe some of those 4 things that I mentioned and see if that applies to you. And if you can't kind of figure some of this stuff out on your own, then seek some help from a pelvic floor physical therapist, because we are certainly trained to help help guide you in the process of restoring the system, even post-surgery. And we can provide some hands-on assist too to get that scar tissue moving a little bit better. Do some hands-on stuff for like some neuromodulation to relieve pain, nerve pain. Maybe there's some nerves that are kind of caught or pinched or not moving quite as well as they were prior to the surgery due to some of the inflammation or restrictions from the scar tissue. So just some things to think about. And, it's always a good idea to reach out to a pelvic floor physical therapist and get some help there. I would love to hear your guys' thoughts on this information as well, especially if you have had a hysterectomy and maybe you've experienced some of these same symptoms. And I'd love to hear if you were able to resolve some of that either by yourself or with the help or assistance of a skilled clinician as well. So I love this topic. I think that it is relevant and could potentially be of interest to lots of the viewers out there. So anyway, as always, I'd love to hear your comments, and we'll be talking soon.